Every year, World Hepatitis Day provides an opportunity to raise awareness about viral hepatitis, promote prevention, and encourage people to know their status. This year, Blessed Medical Aid Foundation (BMAF), in partnership with General Hospital Ikorodu, joined communities together under the theme of creating a healthier community through awareness.
General Hospital Ikorodu, today we are celebrating World Hepatitis B.
Screening, vaccination, and public health education.
At Ikorodu General Hospital here, we run the hepatitis clinic. Every Thursday, we run the hepatitis clinic from 10 a.m. So if you're hepatitis B positive or you have somebody that has hepatitis B, you can tell them to come to the hepatitis B clinic. At General Hospital here, they will direct you. If you ask for the clinic, they will direct you there. We also run the vaccine clinic too for prevention against hepatitis B, where we vaccinate people. When they come, they pay for it. So we run those clinics here in the hospital.
The activities began with a community rally held that morning as volunteers and the health advocates moved through the community, raising awareness about hepatitis and inviting residents to participate in the screening exercise. July 28, 2026. Communities across the world marked World Hepatitis Day, a day dedicated to raising awareness about viral hepatitis, encouraging prevention, promoting early detection, and reminding people that knowing their health status can save lives. In Ikorodu, Lagos State, the message was taken directly to the community. Blessed Medical Aid Foundation (BMAF), in partnership with General Hospital Ikorodu and the Lagos State Ministry of Health, came together to intensify the fight against hepatitis through a program of free screening, vaccination, and public health awareness. The day's activities began with a community rally designed to take the message beyond the hospital environment and directly into the community. Volunteers, healthcare workers, and members of the organizing team moved through the community, raising awareness about hepatitis and encouraging residents to come forward for the free screening and vaccination exercise. The rally was not simply a procession, it was a call to action. A call for residents to become more aware of hepatitis, a call to stop the spread of misinformation, and most importantly, a call for individuals to know their hepatitis status. With hepatitis often described as a silent disease, awareness and early detection remain critical tools in preventing complications and saving lives. Following the awareness rally, attention shifted to the General Hospital Ikorodu, where residents and beneficiaries began for the screening exercise. Healthcare workers prepared the screening stations while members of the organizing team attended to participants and provided information about hepatitis prevention, testing, and vaccination. The objective was simple: make essential preventive healthcare services available to the members of the community at no cost. As the exercise commenced, residents were screened for hepatitis, allowing participants to know their status and take appropriate next steps based on their results. for those who tested negative for hepatitis B. The program provided access to free vaccination, offering an important layer of protection against the virus. Those who tested positive were not left without direction. They were referred to designated specialist health facilities where they could receive further evaluation, treatment, and appropriate medical care. This approach reflects an important principle of public health. Screening should not end with a test. It should lead to information, appropriate intervention, and treatment where necessary, and continued care. Speaking during the 2026 World Hepatitis Day commemoration at Ikorodu General Hospital, the State AIDS Program Coordinator Dr. Oladipupo Fisher explained the importance of the initiative and the broader strategy of Lagos State.
And that's why the Lagos State Ministry of Health is collaborating with the hospital today.
Of the Lagos State Ministry of Health, Dr. Fisher explained the state's strategy of awareness, screening, and vaccination and need to reduce hepatitis-related deaths. According to Dr. Fisher, residents who tested negative for hepatitis B were vaccinated, while those who tested positive were referred to designated specialist health facility for further treatment. He also stressed the importance of completing the 3-dose hepatitis B vaccination schedule to achieve full protection. Vaccination formed an important part of the day's activity. The program provided an opportunity for eligible residents to receive hepatitis B vaccination and to better understand the importance of completing the recommended vaccination schedule. The intervention also formed part of the broader effort to increase protection among people who may be at risk of exposure. Dr. Fisher noted that support for hepatitis prevention has included the vaccination of approximately 5,000 health workers through collaboration with development partners and non-governmental organizations to expand access to screening and vaccination. The health implications of viral hepatitis are significant. Untreated hepatitis B can progress to serious liver complications, including liver cirrhosis and liver failure and liver cancer. This is why healthcare professionals continue to encourage people to take prevention seriously, avoid risky behaviors, ensure that instruments used for medical or personnel procedures are properly sterilized, and take advantage of available testing services. One of the major challenges in the fight against hepatitis is that many people may be infected without knowing it. At Ikorodu General Hospital, the consultant public health physician, Dr. Yetunde Odusolu, described hepatitis B and C as silent killers because they can progress without obvious symptoms until significant liver damage has occurred. Our message was clear: early detection remains one of the strongest defense against the long-term consequences of hepatitis. To Blessed Medical Aid Foundation, the campaign represents another step towards taking preventive health care closer to the people. A representative of the BMAV encouraged residents to take the responsibility for their health by knowing their hepatitis status. The representative also emphasized that hepatitis can be treated when detected early, while vaccination remains one of the most effective means of protection against hepatitis B.
My name is Akadeda Pola. I'm by profession, I'm a registered nurse. So, about the organization.
The foundation also expressed appreciation to everyone who came out to participate in the exercise and support the campaign. Every person who turned up for screening, every person who received vaccination, and every individual who shared the message with another person contributed to the broader goal of creating a healthier environment.
And what we do is we are an NGO that focuses on medical outreaches, we vaccinate people, we give free medical outreach to people, including medication and testing out to people. We are doing it to give out to people positively. We just make sure that we are having positive impact in our society. And as our local says, building a healthier environment. And the program is saying to vaccinate people for hepatitis B and to make sure that everyone is being screened. We have individuals, we screen individual of 250 and vaccinate individual of 200 out of the 250 that was screened.
For the beneficiaries, the program provided more than access to free healthcare services. It provided information, reassurance, and an opportunity to take a proactive step toward protecting their health. Beneficiaries expressed their gratitude to Blessed Medical Aid Foundation for bringing the initiative to their community and make screening and vaccination accessible. They also appreciated the host community, the General Hospital Ikorodu, for supporting the program and provide environments in which the exercise could take place. The success of a public health campaign depends not only on the availability of medical services, but also on partnership that connects those services to the people who need them. The collaboration between the Blessed Medical Aid Foundation, General Hospital Ikorodu, and the Lagos State Ministry of Health demonstrates how healthcare institutions, non-governmental organizations, developed partners, and communities can work together to strengthen preventive healthcare.
We have a committee under the organization, under the BIMA organization, and I'm the chairman of the committee for the program. We appreciate everyone who has made this possible for giving a positive outcome. The chairman of the organization, my committee, and our volunteers, and the General Hospital and people of Ikorodu that have actually come out to participate. Because if they not come out to participate, there is no we can do that. Now we can have resources at the end of the day. So thank you to everyone who has participated.
Just the Ministry of Health.
Okay, sir, today is World Hepatitis Day. What is the Lagos State Ministry of Health doing to commemorate this day?
Okay, thank you. World Hepatitis Day is commemorated on the 20th of July every year. It's a year to remember and then to call for action towards reducing and creating awareness of hepatitis. Hepatitis happens to be one of the highest cause of death among the infectious disease. And then because of that, because of the low level of awareness, the ministry actually is doing a lot in creating awareness. Currently for this year, we're running radio jingles in the traffic radio and the TV in the Lagos State television to create awareness on the importance of knowing status for the viral hepatitis. So that's currently ongoing. We are in the community conducting testing, as one of them is what is happening in Ikorodu here. We are in Isolo, we are in Ikorodu, and we are in Ajeromi, running concurrently right now for people to know their status, the hepatitis B and C. The test is being conducted free, and then for those who tested negative, the vaccine is being provided. They are meant to get 3 doses of the vaccine, and then we are encouraging them to ensure that they complete. When they get the first one, a month after they should come back for the second dose, and then 6 months after the first dose, they should come back for the third dose. Because whoever does not complete the 3 doses is not fully vaccinated against the viral hepatitis B.
Let me quickly ask you this question, sir. Your message to other NGOs, how are they going to collaborate with Lagos Ministry of Health, just like what we are having today, to ensure that people get this vaccine free of charge? Because we know now that hepatitis is more dangerous than HIV. And what is the government doing to actually subsidize the amount, that's the price for the vaccine? Okay,
thank you. Government alone cannot provide all for everyone. And that's why we are collaborating with different pharmaceutical companies that are producing the vaccine. So we are partnering with Philips Pharmaceutical, with Emzor, we are partnering with Abbott. They are supporting this process, and that's why we are providing this free of charge, the testing and then the vaccination. And then for the community, we are working with a lot of NGOs to support the process so that they can actually provide the vaccine and the testing free for some indigent clients that cannot afford, because we know it's not everybody that are indigent. Those who can afford will be referred to actually access the vaccine at the facility. We have 28 facilities across this that have been trained to providing these services. We have the gastroenterologists in all the teaching hospitals. the Lasot, Lot, FMC, Butemeta. In the General Hospital, we have the Solo General Hospital, Fakoja, Oriri Agege. We have Massey Street Hospital. We have Bagara General Hospital. So all these facilities have gastroenterologists that can provide the service to those who are infected with the virus, because hepatitis B, for anybody that tested positive to hepatitis B, they have to be on lifelong treatment. And then the earlier they start the treatment, the better for them, because the virus destroys the liver cells, and then it can transform to cancer. And then when it gets to that stage, we know the cost of even managing cancer, and then of course the ultimate implication of anybody that has cancer. So we don't want it to get to that stage, and that's why the government is pushing on prevention and awareness for people to know their status. When people know their status, you can prevent them getting the virus. And then more importantly, a lot of messaging are going on the social media, because we know the youth, actually that's the only way we can get them, and we have a lot of risky behaviors, because it can be transmitted through sexual intercourse, contact with infected objects. For today's event here, we are planning to vaccinate 200 people that tested negative to hepatitis B. The same thing is happening in Isolo and Agege right now. So that plan is on. For those who tested positive, will be referred to this facility I mentioned, where you have gastroenterologists that can manage their cases. So the earlier they go to those hospitals to start their management, the better, so that it doesn't advance to the stage that it will transform to cancer. Thank you. My name is Dr. Oladipo Fisher, the State Aid Program Coordinator, Lagos State Ministry of Health. Thank you.